Hi, I'm Susan Taylor with Scripps Health in San Diego, California. According to the American Cancer Society, 1 in 8 women will be diagnosed with breast cancer at some point in their life. But there is good news. Death rates have been falling for the past 20 years, and early detection is key to survival. Joining us to talk about breast cancer is Dr. Farah Nasraty. She is a hematologist and oncologist with the Scripps Clinic Medical Group in Rancho Bernardo, California. Doctor, thanks so much for being with us.
Thanks for having me.
So how common is breast cancer?
Breast cancer is very common. It's the second most common cancer affecting women in the United States, second only to skin cancers. Over 320,000 patients will be diagnosed with breast cancer each year. Unfortunately, over 43,000 patients will die from breast cancer each year. So it's a quite common disease.
And talk about the different types of breast cancer.
Well, so there are many different types of breast cancer. So I try to break this down in a few different ways. For me, first I think about where is the breast cancer coming from? You have different tissue in the breast. The primary areas are the lobules or milk sacs that make milk, and there are ducts that carry the milk out to the nipple. Commonly, cancers start in those tissues. So first I think about that. The next thing I think about is what is the type of breast cancer, meaning is it invasive? Has it invaded the surrounding breast tissue or into the body? Or is it something called in situ or inside? The breast cancer has started in that milk duct or that lobule and it stayed in place. And then the last piece is that there are additional factors and special components we look at within the breast cancer, such as if it's a triple negative breast cancer or a hormone positive or sensitive breast cancer, and that helps us determine what treatment is best for our patients.
And who is most at risk?
Well, so there are many different risk factors that we look at. The most common, though, are being a female or a woman, it's more common, and age. Typically, it's diagnosed in patients over 50, although we see all sorts of ages. In addition to that, there are several other risk factors we think about. So a genetics mutation, such as the BRCA gene mutation, increases your risk. Family history, so your mother, your sister, aunt were diagnosed with breast cancer. We're thinking about that as well. We also think about other factors too, such as if you have dense breast tissue, when you started periods, when you went into menopause, all those factors play a role in developing breast cancer.
And you mentioned the genetics. So if your mom had it, does it increase your risk of getting it?
Yes. So if you have a first degree relative, your mother, your sister, or if we're seeing multiple family members, so all on one side, your aunts, the cousins, a lot of family members with breast cancer, that also increases your risk. And that's something you'd want to discuss with your doctor.
And men can also get breast cancer too, is that correct?
Yeah, so it's much less common. So you mentioned 1 in 8 women may develop breast cancer. It's about 100 times less common. So 1 in 800 or so men can develop breast cancer, and the risk factors are similar. So family history and age, that can also play a role in men developing breast cancer.
So what is the best way to detect breast cancer?
So when I think about detection, I kind of think of 2 parts. So one is symptoms that women may have or patients may have. The other is detection through screening or imaging. So when we're talking about symptoms, it can be any number of findings, but redness in the breast, feeling a lump in the breast or in the underarm, changes to the nipple, nipple discharge. So if you're kind of noticing changes in the skin or you feel something, that would be a reason to get detection or imaging with your doctor. The other piece is screening. So that means doing an image before you have signs or symptoms to try to detect something early. Typically, that standard imaging is a mammogram. Recently, actually, there were some updates to how we do imaging. It used to be women over 50 were routinely recommended for annual mammogram. Just this year, the guidelines were updated to include women 40 and over. So that's definitely something that should be discussed with your doctor.
But there are instances of women getting breast cancer in their 20s and 30s. Are those women who's have a higher chance of getting breast cancer because somebody in the family had it? And in that case, should they start getting mammograms sooner?
So that's kind of a complicated question, actually. And truthfully, we don't fully know the answer to that. If you have a family member, though, sometimes you're recommended for something called high-risk screening, meaning even at an age under 40, you may be recommended for mammogram or breast MRI. That would be a decision with you and your doctor, your primary care, your gynecologist. There are ongoing trials to evaluate this. That's an active area of research. What I would always say is it doesn't matter what your age is, trust your gut. If you feel something, it very well may be nothing. Women have denser breast tissue when they're younger, but you should always bring it to your doctor.
And right, if you have a lump, it doesn't necessarily mean that it's cancer, correct?
That's right. And so there are many other findings in the breast that can be just benign, meaning non-cancerous lumps or bumps. You can have cysts that can come and go. There can be changes around your period. So just because you feel something does not mean it's cancer, but it does mean you should get that investigated or looked at with your doctor.
So the statistics say what, 8 out of 10 lumps are not cancerous.
Right. It's more common that it would not be breast cancer, but should definitely be looked at either with imaging or with a physical exam.
So the mammogram's beginning at age 40. And then what about if you have dense breasts? And the breasts don't have to be big in order to be dense, correct?
Right. So I think sometimes density is confusing, but that's exactly right. It doesn't depend on the size. It's kind of we call it the composition or makeup of the breast tissue. And sometimes we do recommend MRIs for patients who have very dense breast tissue. That would be a decision that's made with your doctor, and the radiologists also help us make those recommendations.
Talk about the survival rate, because the good news is that death rates from breast cancer have actually dropped 43% since 1989.
That's right. It's a really exciting time for medicine, like you said. So many improvements are coming our way. Currently, there are over 3.8 million survivors of breast cancer in the United States. As you mentioned, the death rate has been dropping maybe 3 to 4% each year, and we continue to get new treatments and trials that can extend our patients' lives.
So why have those death rates been dropping?
I think the biggest reason is earlier detection. Our imaging is getting better and better, and we're able to detect breast cancers earlier. Earlier detection leads to improved outcomes and survival. I also think I'm in medical oncology, and there's been an explosion of treatments, so chemotherapies, pill therapies, which are also leading to improved outcomes and improved survival for our patients.
So you go back and talk about the early detection, talk about the monthly self-exams, because that is so important.
Yeah, so there's kind of a couple of parts of this. So typically we're recommending doing your own breast exam, whether it's at home after the shower, some women do it in the shower, both sides, looking under the arm with the flat hand, feeling under the armpits. That's, a big way patients end up coming into our clinic is that they detect something on their own with their monthly exams. And then, as I said, kind of age appropriate mammograms starting at least at age 40, that can also help detect breast cancer sooner.
And how do you treat breast cancer?
So that's actually kind of a big question. There are a couple of parts to breast cancer treatment. So as I mentioned, I'm from medical oncology. Really, treatment is multidisciplinary, meaning we have many different team members who all come together to treat breast cancer. Medical oncology, we do chemotherapies and pill therapies to treat cancer. Typically, the team also includes a breast surgeon and then a radiation oncologist, a doctor who does radiation therapy. I think it's important to mention that there's so many more team members beyond the physician part of the team, and they're integral to care. We really couldn't treat patients as well as we do without having oncology specialized social workers that provide support groups and care, pharmacists who help monitor for medication side effects, our nursing team in the infusion room, and our nurses that help our patients when they're at home. So it's a big treatment team that helps to take care of patients.
The technology has changed so dramatically in the past 20 years, particularly talk about radiation.
Radiation is very spectacular in terms of how much it's changed. We sometimes see patients who were treated a long time ago and they were getting several weeks of radiation and had a lot of side effects. Depends on the patient, depends on the situation, but now sometimes they're able to do 2 weeks or 3 weeks of getting radiation therapy, where before it was 6 weeks or 8 weeks. So they've done trials that show you don't always need that full 8 weeks of treatment and can still have a great outcome. So that's been a big improvement.
And before you had to lay down and get 45 minutes for the radiation. Now they say in a lot of cases, it takes less than 5 minutes.
It's typically, the appointments themselves are quite short, like 15 minutes. And that means getting there, getting situated, getting the treatment. The whole process of it is much shorter than when it used to be in the past. And you're right, sometimes you're in and out more quickly. It takes longer to get into the parking lot than to get your treatment. So I think there's been a lot of improvement there.
Are there things that you can do which will actually reduce your chance of getting breast cancer?
Yes, there are actually several things you can do. So one has to do with diet. So reducing processed food intake, increasing fruits and vegetables. It's kind of the same thing we always say, but it really does have impact. Another thing we look at is alcohol intake. For women, we really recommend no more than 2 or 3 alcoholic beverages a week. There is some data to suggest beyond that, there could be an impact on breast cancer development. The last kind of big important piece has to do with exercise. So if you can, at least 30 minutes a day, at least 5 days a week of moderate exercise, but anything you can do, 15 minutes of walking after work or between activities, that can all reduce your risk of future development of breast cancer. And those are all good habits, even if you have developed breast cancer, to reduce your risk in the future.
Any final thoughts, doctor?
So I think the biggest takeaway from today is early detection is key. We know more and more women are being cured, living longer after being diagnosed with breast cancer. So we talked about starting at age 40, having routine screening mammograms, but I think regardless of age, it's really important to get those self-exams at home. That means feeling the breasts with a flat palm, feeling under both underarms, and doing that at least once a month to keep a close eye on yourself. Always bring up any new concerns with your doctor and let them help you evaluate that and see what's going on. I think if you have a family history, your mother had breast cancer, your aunt had breast cancer, any genetic factors, that's another reason to discuss with your doctor doing screening mammograms or doing exams in the office for early detection. I think, the future is very hopeful for all breast cancer patients and for our Scripps patients. We have so many new therapies coming down our way. So I'm very hopeful for that, but I would just say continue doing your self-exams and going in to see your doctor for your mammogram.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Thank you for having me.
If you want more information on breast cancer, then just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.